How can my lower hollow dropped eyelid be corrected? I already had eye bag surgery. I did eye bag surgery 3 years back. My doctor removed excess fat and tissues. I was satisfied. But now my lower eyelids has less volume, is hollow and dropped. How can these be corrected?
Thank you for your question. You submitted a single photo and you're asking how to deal with the lower eyelid being a little bit lower and some hollowing that you're seeing in the lower eyelid, and that you previously had eye bag surgery. So in reviewing your photo, I can understand your concerns, and clearly there is probably something you've noticed about a change since the time your lower eyelid surgery was performed. So let's understand what exactly the process has been. When you had your lower eyelid surgery, you had fat pockets, and those fat pockets we refer to as herniated fat. Now, when those fat pockets are addressed, a lot of times it is easy to overlook or not pay attention to the adjacent area of the eyelid, we call the eyelid cheek junction, as well as the cheek area or the submalar area. When I look at a patient, I always look at their eyes and I also look at their cheeks. I'm a cosmetic oculofacial plastic surgeon. I perform eyelid surgery and facelift surgery as well as cheek implants. And so I really look at the eyes from a perspective as it affects the whole face. So I will often tell my patients to recognize that there is often concurrent volumetric loss in the eyelid cheek area as well as in the cheek area. A few years ago, I wrote a book, The Fine Art of Looking Younger, and I try to explain to my patients a basic philosophy about these genetic and age-related changes. One is we have descent or laxity. Now, the position of your lower eyelid relative to your iris or pupil and being slightly lower may be a function of the factors that are required for stability of the lower eyelid position. This includes the lateral canthal tendon, which is a tendon that attaches the outer corner of the eye to the bone, the orbicularis oculi muscle, the muscle that acts like a hammock and supports the lower eyelid. And depending on the type of surgery you had, whether or not you had skin removal or whether it was done from the inside, there may still be some loss of support in the middle part of the inside of the eyelid, called the middle lamella, and we refer to that as kind of pillars. And then when the lower eyelid kind of sags in the middle, it may be an indication of that laxity of the support structures under the eyelid. I can't tell you exactly, since a physical exam is required to really understand what the eyelid tone is. We pull the eyelid down and let it snap up and see what the eyelid tone is, called a snap test. And so laxity may be part of the situation with your lower eyelid. If you had skin removal, there may be some degree of a skin shortage. And then in addressing the issue with hollowing, if you look at the rim of the eyelid or I should say the orbit, the bones around the eye, and the space between the rim and the cheek, there is often an involution or a loss of volume in that area. Now, in our practice, how we approach someone like you is we discuss options for enhancing that area of the rim using typically a hyaluronic acid filler like Restylane, and combining that with platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it is used in our practice to stimulate blood supply, collagen, and even increase fat volume in the layers of the skin. You see, from my perspective, the more we are doing regenerative medicine in our practice as part of our surgical procedures and independent of our surgical procedures, such as in hair loss treatment, I am really appreciating the importance of the healthy fat layer under the skin. And why we lose that as we get a little bit older or in related to genetics and sometimes just plain genetic even when you're younger. So that's one aspect. Now, very often I'll actually advise patients to also address a little bit of volume in the submalar area, the cheek area, so that there's a continuity and contour that is very smooth. A lot of times we see patients who have had filler done along the rim or in the tear trough, and it looks like their eyes are puffy. And what we end up doing is either dissolving that or adding volume and trying to create continuity. So I always think of the eyelid and cheek as one unit and looking at it from different angles to demonstrate that there is a paradox of having fat pushing forward when you have bags and ironically volume loss below the bags. So in the absence of a physical exam, I think it's best for you to move forward with meeting with either your original surgeon or other doctors who specialize in treating volume, and at the same time consider options related to the lower eyelid. The lower eyelid is deceptively complex, and support structures have to be in perfect balance to get a really nice almond shape to the lower eyelid in terms of the overall eye shape, and the lower eyelid being a little bit higher so it looks really nice and not looking like it's pulled down and contributing to a look of hollowness. So with that being said, just to review, volume enhancement at the eyelid cheek junction, possibly the submalar area, and also consider procedures related to elevating the lower eyelid position based on some basic anatomic principles. So with that, I hope that was helpful. I wish you the best of luck, and thank you for your question.